Hi, good afternoon everyone. My name is Tizita Tekletsadik. I am a safety and wellness technical advisor at International Rescue Committee headquarters office, and also support here in the local office partnership for trauma recovery, which really focus on mental health for African immigrants. Just to give you that background, but technically we've been working closely with Yilma for almost 3 years, and we've been coming like here and there for different workshops, awareness raising around autism. And I would like to hear from Dr. Singer, and he'll also introduce himself.
Yeah, so I'm Sam Singer, and I'm a pediatrician here at Highland Hospital in Oakland. And I'm really grateful for you all having me. I brought my daughter Nora today too. A year ago I came and spoke to some of you all, and it was really a pleasure. So I'm really appreciative to be asked back again. Thank you.
So the presentation and the conversation will be in English mainly. I can do Amarizinya, English and Amharic, but Dr. Singer will be presenting and as well reflecting in English. Okay.
So maybe before I start, I can just ask, was a small enough group? I understand you all are all educators.
Yes.
Right?
Yep.
Yeah. And tell me what age children you work with.
The ranges.
Yeah.
Some are from 3 to 6,
3 to 6.
6 to 9, 10 to 12, and then 13 to 18.
Okay. So I think that is a really, it's really helpful to think about as we talk about autism, because I'm going to talk briefly about what autism is and what it is not. And then I want to leave lots of time for questions, because I think there are a lot of specific questions that will come up in your work and in your interactions with children and their parents. But I think thinking about that range of development is very important, because one of the things that autism is not is static. It's not the same. So autism is a lifelong condition. And people with autism will have it their whole lives. There's no cure for it, it doesn't go away, but that doesn't mean it's the same at every age and stage of development. Children and adults with autism can learn and develop and change, and the things that they do when they are 3 or 4 are very different from what they do when they are 9 and 10. And that doesn't, so that even if their sort of core symptoms are still there, the core signs of autism are still there, lots of things change and develop as they go along, as they get education the same way that children without autism don't. And I think that's really key to hold on to. Because it can seem sometimes like the learning for children with autism is really slow and difficult and frustrating. And I think it's okay to acknowledge that, especially in those sort of toddler years. The sort of preschool ages. But I think one thing that I always, really emphasize with parents is the ability for growth and development. That autism does not mean that this is the way your child will be his whole life, for example. But let me just start. I'm going to speak very quickly about sort of the basics of autism. Like I said, what it is and what it isn't. What it is very diverse. So we talk about an autism spectrum, and what that means is that there is a whole range of sort of behaviors and abilities and intelligences, and that saying that a child has autism does not really give you a very good picture of what this child is like. Some people with autism are very verbal, some don't speak at all. Most people with autism have normal intelligence, but what that means is that intelligence is spread across a range, just like it is for all of us. So we expect a range. And that's also true with the kinds of symptoms that they demonstrate and the kinds of support they need. So some kids and adults with autism need sort of one-to-one support all the time, somebody at your elbow, sort of guiding you, directing you, helping you with just to function in the world. And many people with autism get on the bus and go to school and go through their days and take normal classes and need almost no extra support. And so autism is not just one thing, it's quite a broad range. The next thing that autism is it's pretty common, and it's becoming more common. So today, 1 in 44 children will be diagnosed with autism, and that's among boys, it's a much higher number, and among girls, it's a lower number. About 4 times more boys will be diagnosed with autism than girls. We don't know all the reasons for this. This is really one of the mysteries, and there's a lot of work going on about it. But I think it's enough to say that this is quite common, and for reasons we don't fully understand, it's becoming more common. Autism shows up, as I said, in lots of different ways, but the real core sign and symptom is difficulties in social communication. And that's probably most obvious when you have a 3-year-old or 4-year-old who doesn't speak. You can tell that they have problems with communication. But there shows up in a lot of other ways. So we talk about the sort of the reciprocity, the back and forth communication in people with autism is not, is limited. There's not as much sort of back and forth sharing and natural communication. And then even for people with autism who have lots of language, who speak very well, you can see some other difficulties in communication, for example, in the way that they use nonverbal communication. They may not make eye contact as well as other people. They may not understand our sort of hand signals and gestures. In my office, often one of the first sort of red flags is if you have a child who's maybe 18 months, a year and a half old. Most children that age only have a few words, but many children have figured out to point at what they want. They want that water bottle, they point at it. And children with autism are much slower to point. And one of the reasons is because they don't quite register that if I point at something I want, that my parent will look at my finger and follow out to that and see what I'm pointing at and understand that that's what I want. They don't have that conception that the people around them have this sort of the same kind of thinking minds that they do. And so they may be slower to point. It's a very simple hand gesture, right? But that's just one example. And of course, there are all kinds of other nonverbal communication we use all the time. We smile, we laugh, we frown, and people with autism are slower to pick up many of those signs. Now again, this is something you can learn, but for most of us, it comes naturally. We just figure it out, even at a very young age, even just months old, right? Babies smile back at you and they laugh with you, and children with autism might do that much more slowly. And then the last of the core symptoms of autism is difficulty in developing relationships. So we see this when young people are just not that interested in other people. They're just as happy to sort of sit in the corner and be by themselves. Of course, that can be a normal thing too, right? Some people let you do that, but or there's also a phenomenon where people with autism want to make friends, but they just don't know how. And part of the problem is because they don't have that back and forth. So they might go up and tell you a lot about themselves and not pause to hear about you, right? So they don't have a natural back and forth. These are the key symptoms of autism. Right? It's really about social communication, which is about how we speak, how we interact with each other, and also all the things we do that don't use words, right? All this, my hand movements, for example. And then there are a lot of other symptoms, and these are much more varied. And I'm going to spend less time on them right now, but these are things like repetitive movements, like flapping the hands, picking at something, spinning around. These might be sort of restricted or fixated interests, so really obsessed with one sort of object or toy, for example, or a particular subject. Right? We know that every 3 or 4-year-old loves dinosaurs, but a child with autism might just be obsessed with dinosaurs his whole life, right? And that never goes away. It's a really strong interest, more than a typical toddler. And then we also another one in this group of sort of these repetitive behaviors might be somebody who's very sensitive to stimulation, loud sounds and blinking lights, and they sort of get overwhelmed by all that sensation. Or sometimes we see the opposite, where people have sort of less reaction to stimulation. There are some people who, with autism, who are much less sensitive to pain, for example, and that can turn out to be quite dangerous to them. We need pain in our lives to protect us, right? So that's another symptom. I think I want to just stop and talk about this sort of hypersensitivity issue, because I think this is in classrooms, and probably in your classrooms, this is something that really matters. If there's a lot of people talking at once, if there's a lot of singing and it gets really loud, or sometimes even just, fire truck goes by outside, that can be enough to really overstimulate a child with autism. And that makes classroom management really hard, right? You busy classrooms like kids, right? Kids are loud and busy. But for a child with autism, that's taking in so much stimulation, and it can be really overwhelming for them and make it really hard for them to participate in what you're doing. A lot of the other behaviors we see, like I talked about the spinning or the hand flapping, and there's a whole range of things, picking at the nails or the skin or pulling the hair, it could be all kinds of things. We think that a lot of those behaviors are a way for people with autism to sort of block out the stimulation that's around them, right? That fire truck going by was just too much for me to handle, or there's too many people talking around me. But if I just go in the corner and spin, then I get to focus on my own body. I don't have to pay attention to all these other things. And in a way, it's a protective thing. I think it's frustrating for parents, of course, and teachers. But it's that child is sort of doing the things to sort of manage his own emotions in that moment, by sort of as a way to block out what's going on around and to sort of focus on his own body in that moment. There's all kinds of other stuff that comes with autism. I'm going to set that aside for now, and talk about how do we decide how severe autism is, because I said that autism lies on a spectrum, and there's all, people who speak, people who don't speak, people with high intelligence, people with low intelligence. But when it comes to deciding sort of how serious is the autism, it's not about what symptoms you have, it's really about how much help do you need in the world. And again, this can change. So there could be a 5 or 6 year old who hasn't learned how to use the toilet, who's not very good at feeding himself, who can't communicate his needs very well. That person might need like one-to-one help all the time, right? Can't be by himself. And then all the way to the range of people who are fully independent, and there are lots of adults, living in the world fully independently with autism spectrum. So when we talk about the severity, what we're really talking about and trying to pin down is how much help does this child need or adult. And now I want to just make sure I say a few things that autism is not, because I think this is really important. I really try not to speak about autism as a disability. And this is complicated, and I think even I sort of slip into the language of disability. But autism is very common. A lot of our friends and families have it. I like to think of it as a developmental difference. It's a difference in the way you move through the world. It's a different kind of thinking, but it is not like being mentally retarded, right? Because I told you that people can have normal intelligence. It's not like being blind or deaf, right? Even if you have sometimes difficulty processing the senses that come into you. I really try to avoid the language of disability and just think that this is somebody who goes through the world in a different way, who forms relationships in a different way. Stop. So autism is not really a disability. It's not mental retardation. It is not static. It's something that changes over time in a person. And I think those are really important things to hold on. None of those are part of autism. The other thing is that people with autism can have really powerful strengths. And I think when you're working with a young child, when you're talking to that child's parents, it's really valuable for everyone. And I think you will feel this in yourself if you can focus on that child's strengths. People with autism may be very attentive to detail, right? They really notice like fine things. can catch things that we don't, right? Because they're might be so detail oriented. People with autism can be very honest, right? They want to tell you the truth because they haven't learned some of these social things that we have, where we, sometimes hide the truth or smooth things over that are not always part of being polite, but there's an honesty to it when you tell the truth that way. People with autism can be very loyal and loving. Some are very verbal, right, and get really good at language and communicating. But others, and often those who don't speak very much, find skills and ways to communicate in other ways. Being very visual and having a great sort of, sense of sort of visual awareness and spatial awareness. Or for example, using music, so that sometimes that's the skill that comes out in people with autism. There's a whole range of those things. So I think it feels better as, certainly as the doctor, we spend so much time, how can we help this child? How can we make this symptom better? It really is a good feeling for me to be able to step back and say, your kid is really good at this. This is a challenge that you don't have. This is something, a strength in your child. And I think it's important to remind parents of that along the way as well. I've got a lot more to say, but I'm going to stop for the moment because I want to make sure we hear the rest of the presentation. And I also look forward to asking questions. And also, if things have come up in your classes, in your lessons, having even just one child with autism in a classroom with, more typically developing children is hard. I think it's okay to recognize that. It's really challenging. And I think what we're hoping today is to sort of understand where some of this behavior comes from and ways to make it a little bit easier. But it will still be hard, and I think it's okay to recognize that, especially with the little ones.
Thank you so much, Dr. Singer. I would really appreciate taking us through, and as well kind of being on the same page and understanding what really does it mean, like autism, how those symptoms and signs really reflect on the children based on their developmental stage and age. It really differs because, as Dr. Singer has mentioned, it's more like really like progress that you see based on the support that's provided to the children. So for me, I'll be really focusing on, like, as a provider, what does really require as a skill, and as well, what are the attitudes that we need to have really to work with children with autism. So just to begin with, I've heard in different communities, because I work as well with African immigrants, not only with Ethiopian communities, but as well Eritrean, Somalian, and other community members, especially in Oakland. So there are issues that are really coming as well, stated that, like, now with African diaspora, it's really now alarming. We've been hearing a lot of kids being diagnosed with autism. I mean, definitely there are things that can be contributing factor, which are external contributing factor, but it's not really like a new phenomenon. I just would like to reiterate that it's not a new phenomenon. It's been there for centuries, and it's been there with human being here in this world. So it's more like now being early detected, because the reason is as well really be like to support the kids who are with autism. Otherwise, it's been there with centuries with human, and because it really born with that, like with us, it's not like something that we develop later on. So I just would like to emphasize that it's not a new phenomenon. It's been there. You might really, whenever Dr. Singh is speaking about like the different signs and symptoms, you might really report, oh, maybe my sister, my brother, or myself, like, had I been going through this experience? It really, I mean, some of the signs and symptoms I also really kind of resonate, like, am I really living with that? Because it's not really early diagnosed because of the infrastructure issues. We don't really have those pediatricians in place, like back home in Ethiopia, how our like hospitals is really working. So I just would like to kind of mention about it's not a new phenomenon. It's been there, but not really early detected. So it's not really like kind of something that really just happened at this point in time. It's just been there with us. So for me, like, the focus is more or less really like the skill and as well attitude, because Dr. Singer has really given us some kind of understanding around what's autism, what are the signs, what are the symptoms, what are as well the causes. So I will be really focused on our, like, what kind of attitude we need to have and what kind of skill we need to have in working with children with autism. this is kind of a summary, like whenever we talk about children with autism or like with autism like spectrum disorder, there are like few like major points. Definitely Dr. Singer has mentioned, but I just would like to emphasize as well. This is really difficulties in terms of communication and connection. So mainly like are related with like communication and connection. It's not really aligned with intellectual impairment or intellectual disabilities. It's more like with their social connection or communication skill that you really see autism. The other one is like there is really a misconception in general, sometimes align it with intellectual impairment, intellectual disability. I'm really glad that Dr. Singer framed it in a way, it's not a disability. So it's really like people are really have unique and different needs. So I would like as well to think through like we have a different unique features and understanding behaviors as a human. So children with autism as well have their own unique needs and interests. So that will really make it more normalized in understanding autism.
I'm just going to interrupt because this is, I think this is such an important point. But again, I want to recognize it's very natural if you're dealing with a 4, 5, 6-year-old who has trouble communicating. It is almost natural to think, oh, is this child intellectually disabled? You can't show me how smart he is. But if this is autism, then the symptom of autism is not being able to communicate that intelligence, not being able to get it out. Now, most kids with autism will learn to speak, not all, but most will, and then they can start to get that intelligence out. But until then, it would be natural as a teacher or parent or doctor to think, is this a intellectual disability? And it probably is not, but it's hard to understand that as, you know. So I think these are sort of sometimes our natural reactions. We're trying to work against that and not have that reaction. But I think it's fair that all of us have probably sort of really wondered, right? This kid can't show me how smart he is because he can't speak it, and he, you know. So it leaves us wondering.
I have a question. Does it ever like present in a non-visual way, like how you kind of described the not being communicative or like retreating to like oneself or doing the repetitive stuff? Like, are there someone that we might like say, oh, this is high energy? You know what I mean? Like, are there non-visual ways that?
Yeah. So that's a great question. So there is I would say the simple answer is yes, because autism can present in a whole huge range of ways. But in particular, there are some people who are highly verbal, and they will come at you and just talk, and so that is not our normal picture of autism, right? But then you realize this person just talked and never paused for me, never showed interest in. They didn't even care that I was listening, right? They just kept talking. And so that's an example. And so what you're seeing there is somebody who's very good at language, but not good at the back and forth communication. And that is, so again, that's the key symptom, even though it looks different than we might expect it to look.
Thank you for flagging that. And plus as well, these signs and symptoms can be as well very confusing for parents or people who are around them, working with them or helping or supporting them at different spaces. For me, I think ultimately the diagnosis should be made, and really that decision really come from someone who's really experienced with that, because sometimes like people who are really like doesn't have any autism, they might reflect those signs and symptoms. So I don't want as well to make that kind of judgment without really the actual diagnosis and the result, because kids at that age might really have different reflections, and how they reflect to the external world that is very much different. So I think the diagnosis is really crucial to make that kind of decision and think through the
Yeah, I completely agree. It's not easy to make the diagnosis, especially on a young child. And you need not just an expert, but it's not something I do in my office in a 15-minute visit. You need to go to a specialist who can spend a couple hours with the child and do sort of a range of testing to really come up with it. The other thing I worry about, you may have seen this happen too, is teenagers go on TikTok and hear about autism, and then they come and say, I think I have autism.
Don't we all?
And I say, no TikTok diagnosis.
Yeah, and as well, recently I've read as well as certain research in saying that, especially for the girls, like kids and toddlers, it's really hard even for like maybe therapists and as well pediatrician to make that diagnosis, because naturally girls are like really communicative, and in terms of language wise as well, they are really easily get that point, and as well that's more naturally gifted. So it's kind of confusing as well, especially for girls at early stage, and that also a natural piece, but at the same time it's been really make it very difficult to have that detection, especially for the girls. So it has a lot of contributing factor, and as well, even if you see like different signs and symptoms, that's definitely a aha moment, and really to take measure forward in terms of support, like reaching out to the pediatrician, maybe a therapist and so on, but it's not really like a conclusion, like, oh, I've seen this and so symptom and that's autism. I think that's, that should not be the case, should be through the proper procedure that we need to know. The other one I think is already been mentioned by Dr. Singer around like, they may or may not have a problem understanding language and expressing themselves, because as I said, like for girls, especially in the early like toddler stage, they might be very expressive enough, but they might have autism, so you can't really understand when the proper diagnosis is made. Otherwise, they might really live with autism, but not really early detected because of their social skill. You might see as well unusual speech pattern or repeat words or phrases that's been also provided by Dr. Singer. They may have also unusual movement or response to sounds, sights and touch, or express discomfort with change, seizure, intense anxiety or difficult paying attention. So these are kind of main components that I would like you all to take into account in thinking about the autism spectrum. So for me, the focus is really around like what are the common myths about autism. So አሉታዊ አስተሳሰብ የምንላቸው አሉ አይደለ? Within our community, there are lots of misconceptions around autism. It can be through like our culture, our understanding, our way of life, some conceptions, like misconceptions in there within our community, especially with autism. So I would like to really flag on that and would like to hear from you all as well. What are the things that you notice as a most common misconception around autism? Do you experience any misconceptions around autism?
It's a disability.
Yeah.
Is that okay?
Be a big one.
I mean, I think we're kind of learning more and more now, so it's not as common, but people would take it as a curse. People would take it as even, a result of someone sinning, and it's, punishment for their sin, or all these kinds of things, right?
Mm-hmm.
But the disability that it's not fixable.
Yeah.
Yeah.
Mm-hmm. Thank you for flagging that. Any misconception that you hear in the community around autism?
I think part of it is also like bad behavior. Kids are just being hyper and just being troubled kids, and like maybe the parents are not punishing that kid, or behavior or discipline issue from the parents' end. So
I mean, my own misconception was that it did present in a very specific way. That's why I asked that question earlier. Like, are there other ways that we might not, necessarily think, or maybe like do that? But
Yeah, some people think like, kids are not properly mannered. Like if I speak and I'm like, ወላጅ በስርዓት ስላላሳደገው ነው ይሄ ልጅ እንዲህ በቃ እንትን የሚሆነው የሚል አይነት that kind of misconception.
Yeah. No, thank you so much for really sharing those misconceptions. Definitely, if we do like some kind of dig or some research around this, definitely there will be dozens of it. because I mean the stigma, the discrimination, sometimes isolation to the parent caregiver and as well as for the kids who are living with autism, really coming from the misconception that we have within the community. Those misconceptions that we kind of really discuss here, it really makes us like being judgmental and really denying the issue sometimes. Sometimes it's a struggle even for the parents to really convince themselves and try to really support their kids because of all the stigma, the isolation that we have within our community because of this deep-rooted misconception.
I have two more to add. So one is like typical vaccines. A lot of people think vaccines cause autism.
Yeah.
And another thing that I hear is people living in low-income area buildings that have certain chemicals that could cause that, birth defect and autism and stuff. So if you can clarify that, if there's any research connecting that.
I can. I'm glad you brought that up. So the there is very good science now about the vaccines, and that there's no connection between vaccines and autism. And just as an example, it's something a lot of people worried about all over the world. In Europe, for example, people got quite worried about that the measles vaccine would cause more autism. They started giving less measles vaccine. And at the same time, there were increases in autism. It was very clear that it was, that just doesn't fit the science, right? So we really don't think it's from the vaccines, and it also never really made sense sort of biologically what the relationship with the vaccines and autism would be. But I do think that there's a lot of suspicion and ongoing research about environmental chemicals. And that is a real thing, because I've told you that autism is increasing, and I told you we don't know why. And I think there is a lot of suspicion that it's about some chemicals. Now, unfortunately, we don't know which ones, and it's really hard. So there's been some research for certain medications that mothers take when they are pregnant may increase the chance of autism a little bit here and there, but that science is still very new and not very clear. We think maybe things like agricultural chemicals, pesticides, maybe. It is not clear that there is a socioeconomic gap, but right, that it's all just more in low income areas. I will tell you that some of the biggest concentrations in the world of autism are here in the Bay Area, but in Silicon Valley, right? High income, high education population, and very high rates of autism. And again, we don't know why. So I think, I do think we are going to learn over the next, decades that more about the role of these chemicals. But it is too soon to say it's this chemical or this one, and it's hard to not know. It's hard.
Thank you.
And I have another question. I'm sorry.
Yeah.
So when we're talking about vaccine, so I have a son with autism. So he was diagnosed after when he was 2 years, after 2 years old. So the reason why people have this concept of saying it's because of the vaccine. Because when he was toddler, he was very active, he was laughing, he had eye contact and everything. So suddenly when he started, when he was 2.5 years old, he started to look at away when he's not engaging with his aunties and with relatives. And I still have the video, so that's why is it did he born with it, or the symptom comes after 2 years old or when they're a little bit older?
Yeah. Well, thank you for saying that. This is really important. And I think the answer to your question is actually, you said two things, is both. He was born with it, and the symptoms don't really appear until later. And one of the reasons for that is because sort of our expectations for behavior of a 1-year-old, a 12-month-old, 12-month-old just sort of stumbles around, right? Says a couple of words, maybe, doesn't really understand what we're saying to him. So our expectations are pretty low. And the other thing, and this is very typical in autism, is that they're between that 1 and sort of 2.5-year-old age, it is not uncommon for there to be sort of developmental regression. And often that's our first hint that this is autism. This child who was saying mama and dada at 1.5, stop saying those things. And that's not normal development, and that often is one of the first signs of autism. And I think it's fair to say, and I think this is what you're getting at, we give a lot of vaccines between 1 and 2 years old. That's, there is, and so it is not unnatural, I think, for families who are struggling to find an answer. We don't have the answer. To think this happened at this time, this was the same time when my child got vaccines. They might even say these vaccines gave him a high fever, and that could have happened for sure. So I think it's quite natural for families to put those things together. But what the science tells us, looking over, thousands and millions of children now, is that there is no greater risk in autism in children who have been vaccinated and those who have not. So those things are happening at the same time, but turns out to be an unfortunate coincidence, not a cause.
So just expanding on that chemical exposure, and could it be acquired, or in this case already just born with it? Is there instances where kids can acquire this after they were born?
We really don't think so. We think you're probably born with it. Yeah. But of course, nobody can diagnose a newborn with autism, and that is hard. Now, one reason we say this is because it is very clear that there's a genetic component to autism, and of course there are families that have children with and without autism. But if one child in the family has autism, there's a much higher chance that another child will. And parents with autism are much more likely to have children with autism. So it's clear that there's a genetic component, right? And that's clearly something that's present before birth even. But the real answer to this is that there are many factors. So it is some chemicals that we don't know about, some genetic factors that we are just beginning to learn about, and really a mix of things. And we don't have the right answers still, but we will know a lot more in the next few years.
I've got a question too. So, I think I heard you say that in the Bay Area it's on a larger scale. So, Bay Area, as we know, is a lot of electronics. So, little kids, I see all the family giving their phone, I don't know if is there any relationship with that, and at the same time, how about food, GMO, non-GMO, gluten-free, gluten, and all this kind of stuff, what effect all this has? Is there any research?
There is, and so, but let's separate a couple of things. So this is an important question too. I want to distinguish between what are things that may cause the autism, and then there's another sort of concern about how can we treat some of the autism symptoms in older kids who are already diagnosed. And when it comes to the causes, maybe being around these environmental chemicals, including the electronics, is a cause, and we don't know that. But a child looking at the iPhone a lot will not develop autism if he does not have autism. That's not going to, right? Because that's something that you've already got. Now, I think all our children should spend less time on screens. But that's not related to autism. That's just my personal feeling. So I don't think that's one of the causes. I do think that screens are not good for our kids, in many different ways, and that's a different conversation probably. Now, when it comes to the food and chemicals in the food, again, the answer is we don't know. That there may be some agricultural chemicals, pesticides, herbicides that are on the food, and that those may contribute or may be a contributor to children being born with autism. But there is no science or evidence that changing the child's diet as he grows up will affect those core symptoms of autism. So it's sort of, you might be born with this condition, but changing the diet along the way is not really going to change the core symptoms. And I think, again, this is one of these natural things for parents, because as parents, feeding our children is one of the most important things, right? In your home, in your culture, right? That's how you show love, and you continue to your tradition. So food is important to all of us, and I think it's natural to think if I can change this, if I can adjust this, it will get through to my child. But the science has not really shown that over time. So did that answer your question? There may be some relation to food, you know, chemicals in the food as a cause, but in terms of treating the symptoms for a child with autism, changing the food is probably not going to help. Now, the one exception to this, and this is important, is that there are some associated symptoms with autism that are not part of the core symptoms. Kids with autism can be very picky eaters. Kids with autism can have a lot of problem with sort of indigestion and constipation and sort of a lot of belly problems. And sometimes adjusting the diet can help those things. But in terms of the core symptoms, the social communication, a new diet won't change that.
Question. Has there been any research that children with autism has been like, can they grow out of it and become like normal?
Yeah. I think they will always have autism, but they can become much more normal than we expect sometimes. And so I would not set the expectation, and I don't think I really believe that autism goes away, but people definitely learn and develop. I have just an example that's been very present in my mind recently. A little boy I take care of, he seemed to have very severe autism. He didn't speak. Really, really hard for his mother. It was really hard for his big sister, because now all of his mother's attention went to this child who was so hard to manage and control. And I never heard him say a word, and he just was like bouncing all around the room, really tough. And then he went to kindergarten, and within 6 months he was speaking, he was following directions. I couldn't believe it. I thought this would be one of the kids who never will speak, and now he speaks surprisingly well. He answers questions, he puts sentences together. It's like a shocking. So he still has autism, but he if you think about how much help does he need to move through the world, much less help now, because he can communicate by himself. So, and I think there are even more dramatic cases, right, where we talk about eye contact is one of these key things. Eye contact is something you can learn, you can practice and do it, right? You know, and so somebody who makes really good eye contact with you doesn't seem like they have autism, but it's because it's something they learned and practiced and developed. So those symptoms can become less and less, but I think the core condition remains.
Yeah.
One last question, sorry, and we'll go to the training. If early diagnosis has not been done, and if someone is in adulthood, can you still diagnose?
Yeah.
Once they reach adulthood?
Absolutely. It is harder to find a psychologist or a specialist to do the testing and diagnosis, but it can absolutely happen, and there are lots of stories of it happening. And I think for some adults, it's a really nice thing. They think, gosh, all through high school, I had so much trouble making friends, and I was, I always felt separate. And when they get that diagnosis, it explains a lot about them. It also makes them feel a little bit more okay with it. Because I hear people talk about becoming more normal, or can we fix this? And it's natural to use that kind of language. But a lot of adults with autism would say, no, this is who I am. I don't want to be different. I don't want you to change me. This is my identity. This is who I am. This is how I go through the world. And I don't need to be cured. I don't need your treatment. So a lot of adults, and there's sort of a now movement for sort of being proud of your autism. And I think that's hard for some of us to fully wrap our heads around when we see the challenges, but especially for adults, it becomes a very core part of their identity, and can be really validating to know that when that diagnosis comes late.
Yeah, thank you so much. Really appreciate. I mean, some of the questions that you flagged is really in line with misconceptions. Do you have a question?
Go ahead. I have a question. Go ahead.
I was just summarizing so that I can go through the misconceptions. Yeah, I mean, some of the questions that you've really flagged here, those are all misconceptions that we have, and I'll also include it here in the PowerPoint slide, how the evidence and facts really support, and as well being against those conceptions that we have, because as it's been clearly articulated by Dr. Singer, there are really like research that's been done around this, and those things really supported, and whenever you see those evidences, okay, like that's really like an answer for all of us as a community, and I've recorded here. But Sita, you can go ahead before I go to like each misconceptions. Yeah.
Okay, I'm afraid if I'm jumping the gun, apologize. But one of the goals for me to get here is two things. The first one, how to identify a child who have autism. So you give us some clues, and we might use those clues to identify them. The second goal I'm having, where I want, is how to help them. Majority of these people are instructors and helpers. So I think we might have the same goal in terms of how to handle these kids. So the first one you mentioned, the second one, okay.
Yeah, I'll be covering, but if you have things.
I have lots of ideas about this, but
yeah, I think the question really coming beforehand, before the presentation.
should we wait then?
Yeah, we can
Okay,
wait, because some things I hope we'll cover. So, because of the misconception, we have different attitudes, and that we can call it resistance in some way. Like here, as you can see, like denial. Sometimes we can be, as a parent or a family member or community, we're in denial. Like we don't really validate and recognize, and we don't go forward in terms of seeking support. So this is really like a resistance attitude, and that also really prohibit like the kids from accessing services. So this, we call it as well an attitude, which are really resistance, and as well preventing the kids from accessing service. The other one is minimizing the issue. We know, like in our community, we have a very multifold of different challenges and problems. Whenever it comes to autism, there is as well like kind of minimizing. Oh, it's just communication, it's just a connection issue, and try to minimize. Whereas like the kids can definitely get those services and really mitigate all those challenges that they encounter. So the other one is around justification. Sometimes from the community you see a certain attitude, like they will give you some kind of source of justification. Oh, like the kid used to be like really have that connection, but now he has reduced. That's also kind of our attitude, being resistant in accepting and validating the issue. Whenever we validate the issue as a challenge, we go forward for seeking support in accessing services. But if we're resistant to begin with, it's really hard to get the support that's needed. So sometimes we justify, give a lot of reasons and justification, or because it's not really like in our community, it's just a new phenomenon. It's all a justification. It's been there, and we should validate that the problem exists, and we need to get a proper support. Whenever we have that attitude, positive attitude, we'll be open in seeking support. The other one is blaming the child and parent caregivers. It's been mentioned previously as well. There are lots of misconceptions, like, oh, it's a curse, it's because of a sin from the parent or from the child. I remember in a Bible quote, I think we have a religious priest here, and as well someone who's really have this wisdom. Just to share, I remember like in one of the biblical studies, እግዚአብሔርን ጠየቁት ይላል አይደል? ለምንድን ነው አይነ ስውር የሆነው? በቤተሰቡ ጥፋት እና በእነሱ ኃጢአት ነው ወይስ ልጁ ኃጢአተኛ ስለሆነ ነው ሲል የእግዚአብሔር ሚራክል የሚገለጽባቸው ስለሆነ የኔ ማንነት የሚገለጽባቸው በእነዚህ ነው ብሎ የገለጸበት ቦታ አለ አይደል? ስለዚህ ሚስኮንሰፕሽኖች ብዙ ጊዜ ስታያቸው blaming, judging, ምናምን የሚመጣው ከኛ አስተሳሰብ could be cultural, it could be traditionally we build a certain knowledge and understanding about those issues, and we could be like blaming those parents or kids, which is not their fault to begin with. So this is one of the attitude or the misconception that we have. Comparing issues. Sometimes when you talk about autism, people might tell you, oh, we're really like now considering Ethiopia, we're in a conflict, and you're talking about autism, which is not really comparable in terms of magnitude and the challenge. but we shouldn't really broad those kind of comparison among issues. Whichever the case is, even if it's one individual, it's an issue. It's a challenge that needs to be addressed. Even if it's a single individual, that needs to be treated equally. The other one is reinforcing norms. Sometimes you might hear, like you're an educator, you have really in-depth understanding about this issue, but because the misconception exists in centuries, there is always like reinforcement. Even if we are as educators, sometimes we might even really reinforce those norms and practices in our community, which can be much worse because we are a provider, which will be much worse because as a provider, we should be open, supporting those kids, parent, caregiver, and if we reflect those kind of norms and practice, that can be much worse in impacting those kids and as well as parent, caregiver. Because we are a provider, we'll not be judging or blaming or giving a justification because as a provider, we should be trusted. We should be like a start point for healing for that parent and as well as for the kid. So I'll share as well here like what are like the misconceptions that we have. I think more or less you covered it well, but I just would like to really emphasize on some of the common misconceptions, not only for Ethiopian communities, but in general, there are like a lot of misconceptions among children with autism. The first one is autism is a mental illness, which is not. Autism, Dr. Singal ቅድም እንደገለጸው አብሮ የሚወለድ ነው። all of a sudden the mental health ከበርዝ በኋላ ዲቨሎፕ የሚያደርጉት አይደለም። ከመወለዳቸው ጀኔቲክ ሊሆን ይችላል፣ የኬሚካል ኢሹ ሊሆን ይችላል፣ የተለያዩ ሩት ፋክተሮችም ብዙ ጊዜ ይገለጻሉ። ለምሳሌ እናት ፎሊክ አሲድ በስርዓቱ ፕሮፐርሊ ስላልወሰደች ሊሆን ይችላል። የተለያየ ሪዝኖች አሉ፣ ሩት ፋክተሮች የተጠቀሱና ቤዝድ ኦን ሪሰርች ማለት ነው። በተለያዩ ሪዝን ነው አብሮ ነው ግን የሚወለደው። It's not something that you develop as a mental health issue because of certain challenge, because of issues how we treat the kids and things like that. It's not the case. It is really natural. It's also born with the kid. So the fact, whenever I say fact, it's based on evidence and research. There are lots of rigorous research being done, and it says autism spectrum disorder is a developmental disorder stemming from change in the brain before the child is born. It's not a mental condition that develops after birth. So that's really kind of highlight and give some kind of clarity in terms of our perception around whether it's intellectual disabilities, whether it's a mental health issue. It's clear that it's not a mental illness. It doesn't really come later on after birth. It's really born with it, and it's yeah.
But I have a question. But it kind of contradicts with this. It says like it's developmental disorder, right? And then we say it's not disability.
I try to say it's a developmental difference.
Oh, okay.
But it's fair for you to say that because I think even we trying to be very clear about it, we slip into this language.
Yeah.
Right. And I think it's something I continue to work at, but we slip into the language of disorder, disability, right? Or it's have to do this therapy now. Well, if it's not a disease, why do you do a therapy for it? So it's a fair comment. And I think we do slip there, but I think it's something to strive for, to approach this as a difference, not a disease.
Yeah.
Thank you.
No, that's a good point. Even like within the system.
Yeah.
If a parent would like to access services, it really fall under a disability category in accessing benefits. So
That was it, okay, I was just gonna ask that, cause it would just limit otherwise.
Yeah, no, if you go to school, it's special education right along other disabilities. So it's from the systems, from the the medical care. I agree, it does often get treated that way, even if we would like to sort of adjust our framework and perceptive.
Sometimes I think that I have the disability because I will kind of understand it later what like in what point he's coming from. So like maybe we will start to fight with my son, and then I'll understand it later. Oh, I know what you're saying. Like I will blame myself after that.
yeah.
Can I just pause? I think what you said is really important, and I think it's important for any of you speaking to parents. that there is some studies where parents, and it's particular mothers, to be clear, of children with autism often have the same kind of anxiety symptoms that soldiers who've come back from war have.
Yeah.
That idea of being on edge. When's the next explosion going to happen, right? Or, you know, is he about to run away? Do I have to go chase him down, right? Always being on edge, so keyed up, because having a child with autism can be really hard. And that the symptoms, like I said, somebody who's been in battle, and it's the same kind of symptoms as often a parent of a child with autism. So, I think it's fair to recognize the challenges, and that sort of ongoing discovering things about yourself and trying to get better understanding your son. It can be really hard.
Yeah, in general, I think what I can say in different, not only like with autism, but with different issue, there are lots of time that we pause and learn, relearn, and try to unlearn things, because research really come here and there and with different perspectives and findings. And sometimes it might not really pre-inform the system or the thing that we work, like in terms of, for instance, calling it as a disability even within the hospitals or different public benefit. So it needs to be informed with different proper researching and things like that. But there are times that, as well as a provider, there are points that we learn, unlearn, and relearn on the things that we do. So definitely with a provider as well, there are lots of things that need to be learned based on the findings and research that will be coming more progressively. When Dr. Singer was mentioned, like in this decade or things like that, we will learn more about the root cause. It's all about like learning, because it's like communication and social interaction issues. So it needs to be really discovered based on different pilotings, assessment, research on this field of area. So definitely there could be those kind of misunderstanding and like conceptions as well, like this misconception, not only like a general community, but as well providers have this kind of misconception that exists. They are also part of the community. You all are a provider. We all have a misconception. So you might not see as well this very neutralized and as well very informed kind of things in different service delivery. That doesn't mean that that's the reality. So a lot of advocacy is expected from the community, from the parents, and as well lots of research expected in this field of work. So yeah, autism is caused by vaccine. It's a misconception. It's been already flagged. And that's why I was saying that we are coming beforehand while we have the presentation. So there's no really evidence that childhood vaccine cause autism. In 1940s, based on the research that I've seen, 1940s, around there is a connection, like a research being done around measles vaccine that's connected with autism. But in 2010, there was a finding that really find out there are errors and mistakes around the ethical procedure in that research. So it's invalidated the finding that they had in 1940. So research and finding sometimes really comes like progressively, and that could be changed. Sometimes you see different research. Oh, like wine is really helpful for your heart, and then later on, after 10 years, some finding will come out. Oh, wine is really like result heart attack. So it's more progressive and things that we learn through research and evidence. But for now, based on the understanding, it doesn't have a direct correlation between vaccine and autism. Autism can be cured. It's been mentioned previously. It's not something cured like totally or 100%, but as Dr. Singer has mentioned, early detection really help you like in terms of really making those changes, like social skill, emotional regulation, adaptive skill, they are learned. So that can be improved time to time with a proper support. It's not curable, but it can be really like improved to a certain extent without even sometimes you might not even detect, because you might see adults with autism and it's really barely it's visible with adult people. So it's really hard like to make those kind of distinction. Autistic children do not like to socialize. This is also a misconception. Some children with autism really want to be alone because there is also that skill around social connection. But based on research that shows that there are children with autism who have a desire to make like friends and things like that. That's their desire. They have that desire, but sometimes like with these old misconceptions and understanding, they might be isolated within the school communities, within the school setting. So the fact is like they have a desire, but sometimes the external environment might limit them to build that connection. Autistic individuals or children can be dangerous, which is also a misconception. It's very rare autistic children to act violently out of malice. Like they don't really have a malicious perspective to really act against like another kids or to be dangerous. The vast majority of them, even to the extent, are very much calm, kind, and willing to help out other kids. So this is really like based on evidence that's been done with children with autism. So what do we expect from a provider? So as a girl, like an educator, this is like the positive attitude that we expect. As a provider, we should believe that they have a right to live freely without any forms of discrimination. Because whenever they come to school or to any community setting, we should not really discriminate them or unequally treat them. They have that right to live free from any forms of discrimination. The other expected thing from us, having a positive attitude, is parent or caregiver should not be held responsible or blamed for having autism. So we've said that like we shouldn't really hold accountable the parent and caregiver, or you're at fault, you're the one who really caused this, and like even blaming the children. We should not really have that kind of understanding. The other one, we should not be stigmatizing them, shaming them, or ridicule them because they are living with autism. The last one I would like to bring is really about, whenever we say about positive attitude, with a proper support and early intervention, we can really decrease the severity of the symptoms. So even if it's not curable, our intervention is really immense, like it's really significant in making those changes in the children's lives. So that's more like in terms of thinking through like what are the attitude as a provider I should have while working with the kids. So apart from the attitude, definitely we've flagged about the misconceptions and misunderstanding around that, and we have seen as well facts based on evidence. This one is like the skill that we need to have as a provider. The first one is like really having a skill in terms of showing respect, demonstrating respect for the children with autism. When they come to us here, this is like a safe space for them. We should really contribute for healing. So we should be respectful. Like sometimes you might see like giving less attention for children with autism. Sometimes you might see like, oh, this kid is like living with autism, so they might not understand me, or they might be really vulnerable. So let me talk to the parent. That's really disrespectful the kid. So making sure that speaking with that kid, understanding them, communicating them properly is one of the skills. The other one is creating a calm and safe environment. As Dr. Singer has mentioned about, like sometimes it can be triggering, and those kind of situation, like the sound, all those things can be really like triggering for them, and it might really make them not to behave in a certain way in those contexts. So in our condition, especially as a provider, do we have a space and calm space for them, particularly in treating them specially for those kids? So creating calm and safe environment is really key. Like for instance, use of soft voice, like whenever you work with children with autism, turn off bright lights, turn off music or loud noise, avoid touching. Like for instance, sometimes in our culture, touching or hugging them is really like common, right? That's our culture. But sometimes for children with autism, it might not be the case. Like it might not, like as we expect, they might not reflect or react in a way. So avoiding those things, avoid touching or use non-threatening body language. So sometimes whenever really discipline the kid, like, yeah, stop doing this and that, like we should not really treat them in that way or communicate them in that manner. The other communication skill is like, it does not interrupt repetitive behavior. So like they might really have like, because children with autism have a repetitive kind of behavior, that's been like mentioned about like rocking or loud talk and things like that, and we should not interrupt them if they really demonstrate those things during class. So unless you expect sometimes like harm will be there, or if we are causing a further harm that we should prevent, otherwise we should not interrupt them. If there are repetitive behavior that you notice with the kid, we just like sometimes ignoring or like making it like overlooking those like whenever they show those kind of things, just overlook them or ignore, so that they will not be emphasizing, or they will not feel they are mistreated in that space. The other one is use short phrases and speak slowly and give time to answer. So as human, every one of us, the way we understand, reflect on things is very different, and as well, the range is very different across different human beings, how we interact, how we communicate, how we reflect. Some people like might understand things a day later. Oh, you've said this, and they will call you back. That day I didn't understand you. Now I really clearly understand the issue, and like there are people who understand like a day later, or sometimes a month later. So giving them like a pace to process that information whenever you ask those questions. Speaking slowly as well is really relevant in this context. So giving them a pace. Once you really identify and understand the issue, you need to really treat them differently, those kids.
Quick question. So in a classroom setting where other kids might perceive like these repetitive things disruptive, do we, and I've definitely done it, I've said, hey, like in a nice way to kind of like quiet them down, do we not saying anything, how is that with the other kids?
I mean, particularly for children with autism, if you have that pre-understanding or if you've been informed by the parent, we should definitely like, really commenting or stopping them, because that's where they really felt that they've been mistreated and they're not understanding that. So technically, like at home, even for my kids, I do like ignore things. Whenever you emphasize on things, that will be more provoking. So later learn them new things, and you can really focus on the issue at hand, or focusing on that conversation, continue as if nothing been done. Because whenever you have like that attention, there is also simultaneously some kind of experience from other kids. Could be bullying or things like that. So for me, it's more like ignoring can be one of the tool.
Yeah. I agree, but that's not easy, right? And sometimes it's really hard, right? Screaming, shouting, right? It's hard to ignore. There's no simple answer to this. I mean, ignore is simple, but not easy, right? I think actually I'm gonna just flip it around a little bit, because we've talked about how can we help these children in your classes. I wanna also think really carefully about how we can, one of the ways we can help them is by really working with the children in the class who don't have autism. Because when we include all people, we are teaching a value, and we are teaching the other children, these are your classmates, this is your community, these are people who you need to learn to live with and understand a little bit better. So I would say that kind of, there's a limit to disruption, but that's a chance to do some education to the rest of the class, to say, he's having a hard time, this is his way of settling himself, he's really, triggered right now, let's give him a little bit of space. And again, this is, disruption is disruption, and I don't have a perfect answer for that, but I think I would take that as an opportunity to maybe do some education of the other children, and try, which is not, I don't want to say normalizing, we don't want to normalize disrupting the classroom, but a little bit understanding where this is coming from. And also understanding that a lot of this sort of repetitive behavior, we often call it stimulating behavior, is often not that disruptive. And so if that happens, I really agree that I would let that, let it go as much as we can. You can understand where it comes from, and I think then you're demonstrating to the rest of the class, oh, this is okay, this is, we can let that happen. Because it's easy to say no, like don't do that, because it's often not the behavior we like to see.
Or I guess to draw the attention to myself if I'm like presenting or teaching something, say, hey, I'm talking and listening.
Yeah,
Yeah.
I think that's a great way to do it, yeah.
So, speaking about other kids, what should you do if other students like ridicule or them, or
Yeah.
probably not to their face, but they'll like smirk, like
Yeah, kids are not always
more in the teenage.
Yeah. Yeah. I think, again, I think that's a chance to do educating, to try to demonstrate some empathy, and to sort of educate about where this might be coming from. Like, you're talking about your classmate who just goes through the world in a different way from you, and you can sort of laugh at it or make fun of it, or you can sort of show some kindness about it. But teenagers are not famous for being kind. So that is hard, but I think that as educators, that's what we do. We take those moments to try to catch that and do a little bit of teaching in that moment.
So some level of transparency then is good to talk about it, but not really label it and say, he is autistic. Stay away from it. Stay away from labeling it, but try to use some words around it that says, he's having a hard time. It's okay. Some people go through this. There could be your brother or sister. So, right, have patience and empathy, as you said.
Yeah.
But don't block it. Talk about it.
Yeah. But I mean, you may have a different answer to that. I think that's a really tricky question. Is like, how much are we gonna label it or speak directly to the condition? And I think that really depends on the setting and on the sort of what kind of sort of trust and awareness you have in the group you're with. But I think most of the time you don't have to use the word autism. You could say having a hard time, seems frustrated right now, needs a few minutes to cool off, right? And one reason to use that kind of language is because that's stuff that we all have, right? I sometimes need a few minutes to cool off, right? Or I sometimes am feeling my frustration and need that time. And so to normalize it in those ways, we all go through that. This is a child who may be going through it in a different way. And because I think you're really doing a service to the whole class, too, right? Towards inclusion.
Yeah. For me, socially, this is where we can really impact behaviorally, because this is not really my expertise area. I work with women protection empowerment. My area is gender-based violence, and whenever we have a programming around behavioral and attitudinal change, it really takes 10 years. Sometimes we have a program model that really takes us 15 years to impact in making change behavior and attitude, because that really came from a generation to generation. It's not something that you can change in a day. Just a training, you can have an understanding. Now you have understanding around autism, but that doesn't mean that you will change your behavior or your attitude towards how you treat the kids. So in general, for me, the better that we start earlier is really impactful. For instance, with the youth, this is the next generation that we can impact. This is the time they can really develop different behaviors and attitude in treating different social issues. So definitely this is really a requirement, I think, doing some kind of awareness raising, understanding with our youth community, because this is the generation who accept or kind of taking this tradition, our culture. I mean, the misconception that we took is not really something that happened today. We took it from our grandparents, mother's father, we took it from a generation. So this generation, our generation, the younger generation, they should be impacted and have this understanding so that they can be more positive to this kind of different social issues. So having maybe an awareness session, or even training, similar training like this can definitely happen for the youth so that they can understand. Even if you invite as well children with autism, youth with autism, they will be very much happy to validate and recognize their issue. They are living with this issue, which is not really validated or recognized by their peers. They feel oh, you're having a bad behavior, or you're disciplined, you're not really properly disciplined, or you have this mental health issue, or you're disabled. There is this misconception that's going on, and have this clarity, it will help them to validate and recognize they're living with this issue and as well being accepted by their peer. So I think it's really proper to have this education, sensitization in our youth communities and children as well.
So in terms of lending a hand, like if you want to help, a lot of the times I find it very difficult for me because I don't know how to help, right? And if I want to approach them, now I have an understanding, but I still don't know how I can help a parent. Could it be like overstepping? Like, could I be doing the wrong thing, actually approaching them to help? So how do you know how much help they need?
I mean, in terms of support, especially for this sensitive issue, always it should come from the parent. It should be based on like someone who approached you and explicitly shared with you. You might see like these things and you might feel concerned, and you can tell them politely, like, I see this kind of sign and symptoms. I'm not really like saying it's autism, but I would like to have as a conversation or connecting with you with different provider who can provide you proper support. But whenever you just like approach them and really mention or this request coming from you, sometimes parents feel that they have been judged or blamed. So it might not really have a positive outcome. So this thing really upon a disclosure from the parent, oh, my child is going through this struggle, and then you can be able to support. Otherwise, if this kind of communication comes from you, they feel that's really definitely overstepping, or sometimes it's being blamed or judged. So with all, I mean, so different social related sensitive issues, we don't definitely directly approach to the parent. The issue should come from the parent themselves, so that you can provide the proper support.
But for that to happen, there needs to be some level of communication with the parents, right? So as instructors here at our church, there needs to be that channel. Otherwise, if there's no channel to communicate, they will not approach and share the challenges that they face as well. So having this parent-teacher meetings, sessions are extremely important, so that instructors and parents build relationships, so that parents feel comfortable to reach out and say, hey, I've never communicated this to you, but so-and-so has, he lives or she lives with autism, right? So that level of communication is not happening, at least to my knowledge. So we need to build that relationship.
Yeah, technically, I mean, like things can be dismissed or being a denial because of lack of understanding, lack of information, lack of knowledge. I mean, definitely there could be other reason, but mainly like if someone does not have an understanding or knowledge about it, they don't really approach you like, oh, I have this issue, or my child. It doesn't come that way. So sensitization, creating this kind of understanding will definitely help for that smooth communication and identifying the issue.
Sorry. I think I had a conversation with one of the family members. Their kid experienced some kind of discrimination, borderline. They don't want to disclose their kid is autism, because this all these discussions that we pointed out, saying that the community thinks this kid is misbehaving because of raising a child. And the second reason they mentioned was, I don't want my kid to be labeled as such. So they don't want to disclose it. At the same time, they are watching each one of us. We don't know that kid has this autism issue. We might treat him like regular kid, but the parent is watching us and saying they are mistreating him as if like we know he's autism. So that kind of issues also is in our community. And the major reason I pushed to have this session today is one of that. The kids that we teach, we don't know what kind of kids they are in that spectrum. They might have the lower spectrum or the higher. The higher ones we already know. If I name names, maybe majority of you say, yeah, that kid has autism. But there are kids who don't we even know they have that symptom. And when you treat those kids, when the family sees that, they feel like we know that kid has autism, and we discriminate that kid. So be aware of that, you know. And some of the issue, if you go to that parent and say, we need to discuss about this issue, they don't want to discuss it. They don't want even you to know it, because, you know, their kid will be labeled as such. So,
I
So
mean,
that's why
it
the-
starts. Okay.
No, go ahead, I'm sorry.
No, if it's related, go ahead.
So, the point is, it's a stigma, right? That's the stigma. They think they don't want to be labeled. But Maliku brought a good point saying that, like, we have a general, you know, get together with the parents, just talking about education, how we're gonna, you know, handle this and that. Because on the previous autism, you know, event, the parents willingly come in and say, you know, my kids have autism symptoms, looks like this and this and this. No, from now from Dr. Singer, that we say learning differences, not like, you know, we don't have to label it autism, but I mean, my kid has learning difference. How hard to say that? So the more communication we have, the more meeting we have with the parents, and some parents are come up front, you know, saying, you know, my kids have learning differences. Maybe the other can open up, and we can negotiate, saying that, you know, if your kids have some learning differences, please let us know so we can handle it properly. So I mean, I really support, like, you know, at least once every 6 weeks, having a meeting with the parents is very important, because it gets more, you know, great communication at the same time, knowing the parents come forward, you know, telling the differences and, you know, progress. And some parents, maybe they are willing to tell, like, you know, to the person, you know, from the instructors, the person they like, you know, my kid have, you know, some kind of situation, so can you, like, you know, without like mentioning or, you know, blowing it up, so.
Yeah, I mean, it really goes back to, like, what's the fear? Because I mean, comparatively, community to community is very different. Like, in some community, they are very transparent in having this conversation, and the parent as well doesn't have any fear in bringing about this conversation. Whereas when we come to a certain community, including us, the parents have really, like, a deeper, very, like, that's very fear, and as well those misunderstanding as well, how they can be treated, their kids within the community. So the main root cause is, like, they have a very, like, deep-rooted understanding about autism, like, because of the culture, because of different reasons, and the other ones, like, that fear should be really demystified in a way. So, for instance, if they really have that fear not coming out or being transparent in having this conversation, we should really understand, like, what's their fear? Like, what do you feel if you really talk about this with your, like, family members or community members or within the society as a society? Because those fears definitely related with stigma, the misconception that we have. Or what if he's going to be labeled, discriminated among his peers? Or what if I've been blamed as a parent? Those fears are the things that really makes them not to speak up about the issue. So, as a society, as a community, there are lots of things that we need to do around this area, but as well address their fear. Like, in having, whenever you have a parent caregiver discussion, having that really, like, a transparent conversation. What's your fear? If you really would like to have this conversation openly, what's your fear? And demystifying that based on facts and evidence.
I was going to say two things. One is a question. Is there a term that we use in Amarinya, or is there a common way of describing autism when we speak in our own language that you know of? Or what are, like, if you can give me a sentence to say, how would I say it? Because I think the word autism, just because it's not even Amharic, just makes people say, no, I don't want to do it. Don't say that, I don't want to do it. But we can just describe the situation without the word itself. And then the second thing I was going to say is like a takeaway for us. Like, for example, for me today, I would never just say disability. I would say difference. Like, I would make sure I use that word difference, and I'll make sure if someone is in my class and trying to regulate themselves, I wrote down actually what she said, the word to word. This is his way of settling himself.
but that's my takeaway. Like I can just say it out loud. This is his way of settling himself. Your classmate goes through the world in a different way. So those kinds of things that are just takeaways for us. Yeah.
Yeah.
Phrases.
Yeah.
Yeah.
Like
I mean,
tools.
yeah, autism in general, we are having, with Dr. Siga, we are having a conversation before this workshop. So autism in general, it doesn't have like a specific definition or like term within Amharic, and even if it has, it's also very derogatory. So ለምሳሌ ዘገምተኛ የሚል ትርጉም ይሰጠዋል, which is very derogatory and aligned with our misconception. That's why we prefer to use autism as a direct term, but this is something that we need to as well develop in an area. Like our scholars around mental health should really work on in terms of coming up with these terminologies, because I see as well not only autism but as well in different mental health issues, there are really a lot of derogatory terms which really doesn't help us to normalize the issue in our community. So preference to use autism as it is, but you can explain it. Explain it in a way as it's been stated here. ልጆች የተለያየ አይነት ዩኒክ የሆነ ኳሊቲስ አላቸው። ፍጥረታችን ሁላችንም መልካችን ቀይ፣ ጥቁር፣ ነጭ እንደሆነ ሁሉ የሰዎችም ባህሪ የጭንቅላታቸውም አስተሳሰብ የተለያየ አይነት አስተሳሰብ አለ እና ይሄም ልጅ እንደዛ ነው አይደንቲፋይ የምናደርገው። የተለያየ ማለት ሁላችንም የተለያየ ቀለም እንዳለን የፀጉር ቀለማችን የዓይናችን ቀለም እንደሚለያየው ሁሉ የአእምሯችንም አስተሳሰብ እድገት ልዩነት አለው ከልጆች ሌሎች ልጆች ጋር ማለት ነው። ስለዚህ እንደዛ ብሎ ናቹራሊ ዲፋይን ማድረግ ላይክ ፍጥረት እንደሆነና የተለያዩ ፍጥረቶች ደግሞ የራሳችን የሆነ ኳሊቲስ አለን፣ የተለያዩ ዩኒክ ፊቸሮች አሉ ብሎ ኤክስፕሌን ማድረግ ዳይሬክትሊ ተርሙን ዲፋይን ከማድረግ ብዬ ነው የማስበው።
One thing I wanted to add is I think it's really important to have that rapport with the parents, to your point, so that it comes from them. So what are some of the things that we can do to encourage that, as opposed to us saying, oh, is it autism? Is it that? Is it this? So even, I mean, to your point too, like maybe not in an official way, like in a meeting setting or anything like that, but maybe like highlighting some of the positive things about the kids that we notice in our classes, right? Like I noticed in one of my classes, someone that has been identified as autistic was able to memorize something really quickly, just looking at it once and then just memorizing it. Could I have maybe taken that to his mom and said, oh, you know, it was really amazing. He did that. And maybe like having that line of communication could open it up so that they come to us and say, oh, thank you for saying that, by the way. You know.
Yeah.
So I love that, and it also makes it easier if you, because you could say, he did such good memorization. But now I want to talk to you about how he can't stay in the seat, right? Because it makes it easier for you.
Exactly.
Yeah. And I think that's exactly right. Like as much as you can focus on the strengths is good. I loved your language. You said just checking in. Does your child have any learning differences? I think that's a nice sort of non-judgmental way to say it. I think even in English, there's a lot of discussion about how, you know, this terminology. It's this, people say neurodivergent or neurologically atypical, or even this question of, are you somebody who lives with autism or are you autistic? And there's a debate, and and some people really prefer one to the other, even in the autism community, preferring different language to others. So it is not clear. I think a lot about this idea about labeling, and it's something parents come to us with. They say, I don't even want to go to the testing because I don't want my child to be labeled. But you all know, if you have a classroom of children sitting and listening, and there's one child spinning in the corner, it doesn't matter what label he has. He's the one spinning in the corner. Everybody knows that. And so the labels can cause some harm, but they're also a way to get services and treatments. And I think in the classroom setting anyway, the behavior matters much more than, and I think you all would agree that the behavior matters much more than the label. The behavior is what you have to manage in the classroom.
Yeah, I think to Santiago's concern, I think it's one is the fact that, you know, people still in denial, even parents. And I can understand that as a parent, you know, you hardly believe that your child is somehow have an issue, right? But at the same time, that's why we have a discussion like this, because those parents would can eventually open up about it so we can support them. Because otherwise, if we just recognize that and try to work around it, it's not gonna help them in the long run, right? They have to get the support they need, and we need to have this discussion out there, like we did before.
Yeah. And in general as well, as a provider, we're not here doing a diagnosis. We don't have that expertise, we don't have that excellence. So there are like a designated expert who's doing that. So based on such and such symptom, we don't really just like put in a category like, oh, this child has autism or not. That's not our role. Our role is like how we can really support kids in a very compassionate and understanding way and have that sympathy and empathy while supporting the kids in general. So even I think like the mere kind of identification or reaching out to the parent really comes from our misconception around like, oh, because such kid have such and such symptom and might live with autism. So it shouldn't be the case. I mean, we don't have that like kind of expertise in making diagnosis. So unless that kind of diagnosis has been made, it could be a confusion. Sometimes we might not be really even right. Looking into those symptoms might not be autism reason. So making sure as well what's our role in providing that support. We need to be compassionate, we should have that empathy, sympathy, and as well availing different available supports. But it can be very intimidating whenever we just reach out to a parent just because we see one or two symptoms. It can be due to different reasons. Kids might like act in that way, like maybe as a result of even abuse, like in the home, like there could be different behavioral issues that can be inflicted. So just be mindful of how we can react in a certain situation, and we should not be really doing any identification. It's just more like a general sessions around understanding. The other communication skill is really like avoiding leading questions. They may try to give the answer they think you want, because generally with youth community and children, there is kind of, if you give them a leading question, they will answer what you want. It might not be that real reason. So avoid, like whenever you communicate with children with autism, avoid a leading question because they might answer what you want and that could be misleading for you as well.
What's an example of a leading question?
Leading question means, for instance, oh, because you have this problem. So you give them like the answer already, like because you're leading them to answer in that manner. So they know and they can predict or anticipate what you want from them. So they will tell you yes, or you might tell them like, oh, are you sick today? I feel that you might like have some kind of like being tired or things like that. They might say, yeah, I'm sick, but it's not the reality. So avoid those leading questions because kids in general, they will answer what you want, but it's not the reality. The other one is like ensure you both understand each other. So sometimes whenever we send a question, like whenever we ask a question to the general student, they might respond in a way you might not really asking the question. So mostly like rephrase, like so that everyone is in the same page or have equal understanding. Rephrase it in a way they can understand and use basic language, but at the same time rephrase it so that you can be on the same page. Because they might really have some delay in understanding things or processing. So repeat that question, but in different form, so that you know everyone is in the same page in understanding your question. Because sometimes they might give you answer which is really, really far from the question that you ask because of these differences. So make sure rephrase your question before receiving answer from the kids. Especially provided that you have an inclusive class. It's not really like special class and you just have everyone together, right? So you need to really have that same understanding by creating that inclusive environment. The other one is like prepare them for each step, what will happen next. So if you're planning to have a Q&A or explaining, like let them know in advance. Today we'll have like, in different training, you've seen like, today our objective will cover this and that. So you're already pre-informed what to expect. So whenever you also provide session, make sure they have that pre-understanding what to expect in that specific session. So so that they can be in line or in the same page with you. The other one I think I would like to emphasize, because I'm also coming from the mental health field, so children with autism are really at greater risk in having different mental health issues, because there are different experiences because of the misconception, and the peers as well have different misunderstanding. There could be bullying sometimes, and there could be sometimes abusive or traumatic abuses among their peers or friends or family members. So it always overlaps. Sometimes it overlaps with autism, different mental health struggle. So sometimes when we see like a different behavior, it might not be the root cause of the disorder, like the autism disorder, like the spectrum disorder. It might be aligned with different mental health issues. Like for instance, if a child is coming from a family who has a domestic violence experience, you might see different behavior that might not really align with because of the autism disorder spectrum. So sometimes it can come overlapping, and it can be overlooked, this experience, different mental health experience, because it manifests in behaviors, right? And autism as well have different behavioral issues. So really help you as well to understand whether this is really coming from autism or some other experience. So it needs some kind of like that clarity whenever you work with children with autism.
I have a question. As I'm listening, the information here, I'm thinking about work. I mainly focus on mental health and autism, but more so of like the diagnostic coding behind the scene. So what is the relationship? So I guess autism, so when they're going to a therapy, is it ABA? What is the relationship between?
Yeah, I mean, for mental health issue in particular, like the autism, it's like more like it can be progress, right? So it's more like with development and with their connections and communication. So the ABA therapists, technically what they do is really enhancing this skill, because we said like this is a skill that can be learned and developed through time. So the ABA therapist technically is doing like building this skill, like problem solving skill, coping skill, and as well their communication skills. So they really focus on those skills and improving that, because definitely that helped them as well to improve in those skills they lack. But the connection with other mental health issue, there are different mental health issues, like it's very broader in its nature, that can be caused with different reasons, maybe like some kind of traumatic experience because of domestic violence experience in their house. So that can be overlap as well. Like in addition to the autism, they might also manifest different behavioral issues, but as a result of different mental health experience and struggle. So it's really helpful as well to create that distinction so that they can get more proper support. Yeah, you can send them for ABA therapist, but if there are as well overlapping mental health issues, they need to get an additional support from a specific provider.
Yeah, that I think that's a key point. Is that autism, right? We don't think of as a mental illness, but people with autism are more likely to have many other mental illnesses, anxiety and depression, which of course anyone can have, but is more common in people with autism, attention deficit disorder. So, but I think even for a professional, it's very hard to distinguish these things, right? To tease them apart. And in medical coding, you have to come down on one side, right? Put the diagnosis here, name it here, label it here. But it's often very hard, and as she said, there's all this overlap that is complicated, and of course related to your past experiences too. That's hard.
Kids at some age, they act out just being kids, right? Is there a way to know when a kid is acting out, just being funny in a classroom versus having these learning differences?
Yeah, that's a great question, and there are ways, but they're not always easy. I think one of the keys in autism is that it happens in every setting. So these are behaviors you'll see at home and at school and at soccer practice. Like they show up sort of in a similar. There'll be some. It's not the same on the soccer field, but that kind of behavior is going to be the same in every place. Whereas we know that there are kids in the classroom who act out, try to be funny, try to get the attention, or just whatever, have a trouble paying attention, all the things that kids do in a classroom. And then they get to the soccer field and they do everything the coach says, and they're keyed in and focused, and right, they're upright, you know. And so that's one of the ways we would make a diagnosis. But I think for I think you're exactly right. For any single behavior, it would be very hard to know. You know, you can't tell it in the moment, like one single thing.
Yeah, I also would like to emphasize about like those signs and symptoms. Definitely, unless it comes from like the diagnosis and the result, especially as educator in the school community, like you receive that result, right? And you'll be like pre-informed this and that kid is living with autism. So that gives you more like foundation in supporting. Otherwise, you've seen like in the classroom different signs and symptoms, which might really sometimes lead to some kind of confusion or misunderstanding, because that might not be even the signs and symptoms of the child with autism, because with different developmental stage and age, kids might really act, which is more similar with autism. Sometimes it can be really conflicting and like, oh, my child really showed this and silence. This is very common, again, why we're diagnosing with autism. So it really needs to as well, like, because you see like such and such symptom, we should not really rationalize or generalize in a way like this kid is living with autism, because it's tricky, like with certain symptoms that we see might not be technically like the right thing, like in terms of saying this children is living with autism, unless we have that proper diagnosis and the result. So definitely when you see sign and symptom, that can be like aha moment if you're a parent or if you're a teacher, just to be mindful of and having or finding a proper provider. But really for you, that doesn't mean like a concluding like remark, oh, this kid is living with autism.
I think it would be fine whether the child carries the diagnosis or not to address the behavior. You know, this kid was unusually disruptive today. You could say that to the parent, or he seems to really be having a hard time, you know, with this particular activity, or you know, not doing a great job of staying in the seat. Like then you're speaking to a behavior that's not news to the parent. The parent knows that, of course, well before you said it. And that's much less judgmental too, right? You're focusing very clearly on the behavior itself. At home, when he does this, how do you manage it? And you're sort of, now you have a partnership with the parent, right? You're gonna work at it together. And the parent may disclose a diagnosis or not, but now you're I mean, it's much easier to talk about a single behavior, right? Than with, you know, don't have to go to the condition.
Can I just add, you know, a lot of us work with kids directly, so we've seen over time, kind of have learned how the kids are. But when they're out in the general public with everything going on at church, I can just sense people's tension around the way they act. Yeah. So we really need to give everyone an understanding of how to just know, like, that's why I was asking you, like, how do we say it in Amharic? Because, you know, the key is difference, the unit. Yeah. And it's not misbehavior, it's just difference. Mm-hmm. And if everyone can kind of get a little aha moment when they see that one kid that is acting a certain way, you know, we have lines for communion, and that's when it's very visible. Yeah. And I remember 2 years ago where I was thinking about certain kids when I saw them and thinking, oh, watch out, they're misbehaving. And right away realizing it's autism and it's difference. And now I see them in such a different light, but that's me because I've seen that. Yeah. But for a lot of people that are new, that they don't see that. So without labeling, how do we make that clear that there's a difference? Because people don't know until they go through it, until they see it. And you can talk about it and really like get into it, but at the onset when people see those behaviors, there's a very different way of looking at those children, unfortunately.
I love the example of the communion line. I have a very clear memory of seeing kids lined up, and one kid was just standing much closer, right? He had a different understanding of personal space, and I could just see across the room, he was standing much closer to the person in front of him, and I knew right away that he had autism. Of course, I have a lot of experience with this, but it's that kind of thing. You see the group, you see he's acting just a little bit different, and it was about the personal space, and that was it. I think I don't have a great answer to your question, but I think showing curiosity. Does your child learn differently than others, right? You're just showing curiosity, and then focusing on the specific behaviors, right? Because nobody's asking you all to make a diagnosis, but to say, you know, I noticed that your child has a little bit harder trouble with personal boundaries and getting in other people's space. Can we talk about that, or how do you have any ideas how we can help manage
The
that?
parents know that. It's,
Right, they know that.
We
so
know that. It's everyone else doesn't.
Yeah.
And I think we should speak to those specific moments, because here we are, you know, at church, and there, we know a lot of people see it.
Well, you're the expert in this. You don't need a doctor for that.
Without labeling those kids,
Yeah,
without
no.
making those, you know, like the general ways of educating people about it, or pointing them to resources. It's
But it is fair to acknowledge that there's just not a language for it with us, you know? And I think like each one, take one, it could be like a moment to say when you see someone reacting, you can say, no, that's fine. This, you know, kid might be doing something repetitive, maybe being loud, and just saying, no, that's fine. You don't have to stop him, or, you know, whatever the case may be, like doing our part in kind of like educating in that way, but like in a,
kind of being an advocate for it.
you know what I mean? Like, yeah.
It's not the parent that has to do this. Like,
Yeah,
we
maybe
can do it
once we know what to do, then we can kind of like pass
Spread
it
that
on in
knowledge.
That's the key.
an official manner.
Yeah, technically, like in the field of social work, we kind of use like healing communication techniques. So whenever you have that communication with parent, like using that compassionate and healing statement is really relevant to build trust and relationship with parents. Like for instance, it's not really about like normalizing the experience, the struggle. You need to validate and recognize their challenge, because as a parent who have children with autism, they go like beyond, like triple and over from the other parent in terms of struggle and challenge. So validate and recognize their challenge, but at the same time normalize their feelings and emotion. It's okay to have this feeling, because as a parents who are going through the same experience also feel the same. Like normalizing that feelings and emotion is really helpful, because they feel that they are alone in this world having this struggle and challenge. So using different healing statements, it's okay like to feel this way in this manner. You're not at fault, you're not to be blamed for this experience. That also makes them to feel like, because they are coming from as a community who've been seen as a sinful or being cursed by God and things like that. When you say like, it's not your fault, you're not to be blamed, it's kind of validating the emotions and feelings. So using that kind of healing statement is really relevant when you have that communication with parents.
Sort of unrelated to what's being said, but just in general, for kids with autism, do they thrive or excel in an environment where they're with other kids, or is it better for them to be amongst kids that are like them, or vice versa, like, or alternatively, is it better to work with them on a one-on-one? Because I know the school system generally has the requirement to accommodate kids in that special environment, but here at church, I think it wasn't until just a second ago when she brought it up to our attention that I thought about it. Like some parents might have that expectation that their kid can be accommodated on a level where they could be accommodated at school or other environments. Whereas at church, we typically are working with volunteers that are not necessarily doing this, with special training or anything. So we just kind of teach everyone together. So it wasn't until that one parent just brought it up, like, and this is for the Saturday classes that she was speaking about, but to me that was an eye-opener, because I was like, I never really took the time to even ask what is, the ideal environment for these kids. It may be different from one child to another.
That's the answer.
Okay.
It's definitely different from one child to the other. I think it's quite common for people with autism to get overwhelmed in a big crowd, just too much stimulation. So that is common, but of course not everyone will have that. I have definitely had families say to me in the office that one of the hardest things for them is to feel like they can't take their child to church. Because the child is disruptive, or just they're afraid that the way they'll be looked at, right, by the rest of the church, and that's heartbreaking, right? That's something that's so important for this family that they sort of feel taken away from. But I think some kids will do really great one-on-one. Some kids love the energy and the trying to socialize. In my experience, many kids who've started preschool quite early and get used to that do a little bit better, just because they have the sort of familiarity there and the practice. Of course, those same kids may change schools, and now they go to kindergarten, and it's much harder because it's a different environment. So it's you can't count on those things. But I do feel like the kids who start practicing earlier tend to do a little bit better. But no promises.
For me as well, it's more like creating calm and safe environment for all kids. I mean, it's really essential. But as well, for kids, it depends on the severity that we talked about. So someone who's really have a severe autism, they need more support from us. So that needs as well more special class or different space, which because they need that kind of level of support to understand and really grasp the concept that you're teaching. But so it really depends on the severity of the issue. If they are really in that stage, you can make it more inclusive and bring them in a larger school setting, in the class setting, and they can normally get along with other peers. But the situation really matters. If it's really severe, definitely they might need a higher level of support, and it might be even in a one-on-one setting and structure. But I'm not sure we have that level of resource. That's a question, but definitely as much as possible create safe and calm environment, and as well understand where they are in terms of support.
What can be an example of severe autism?
So severities really depend on the level of support. If a kid, in terms of being for instance, communication and connection, that's really one of the silent symptoms of in terms of communication and connection. If they really have that struggle in terms of that symptom, definitely they need more high level of support from us. That really makes it as well in terms of level of severity. If there are really a real struggle around communicating, connection, and that needs more high level of support. I think the severity is aligned with the level of support needed for the kid.
I'll give you an example that I suspect some of you have dealt with in a classroom. Is a child who just gets up and walks away, leaves the room, right? So this is quite common. We call it elopement, but quite common, and it's one of the supports that many, especially young kids, need. They are not really engaged in understanding what's going on in the lesson. They get distracted, stand up and just walk out. They don't have a lot of sort of social awareness that I'm not supposed to do this. It might be dangerous. They might walk right onto the street if they're not supervised. This happens. This is a real worry, and it's of course terrifying for parents, right? Because they feel like they always have to be almost hands-on with the child to keep them from wandering off. So that's actually pretty common in autism. You've probably seen it.
And needs a high level of support.
Right, and so that's an example of a child. That child might even speak very well, but that's a child who needs a high level of support to stop him from walking away.
But in a classroom setting, again, the reaction should be not be like, oh no, where are you going?
Well, I don't know the answer to that. I'm sorry. No, that's tricky, right? Because you have to protect the child too. You have to keep the child safe, and that, right? And so that's a hard balance, right? There's certain things I completely agree. If you can be patient and just sort of ignore the behavior, I think you are modeling something helpful for the other students. But some of these behaviors are too disruptive or too unsafe, and that's tricky.
Yeah, I mean, we should be very mindful of repetitive behavior. Definitely, we could be ignorant as much as possible, but to the extent of not harming themselves or somebody else, we should be intervening on that. That's an exception. Safety is a priority, so it's been mentioned here as well. If they are not really getting hurt is hurting somebody else, that's where we intervene.
I would say also one about this sort of avoid touching, which is something I agree with in general, because a lot of kids will be sort of oversensitive, and you'll really you might throw them off with even just a gentle touch on the shoulder. But there are many kids, especially who are a little bit less verbal, where asking them to sit back down or telling them, that's not going to work. But if you have the understanding, some relationship with them, where that gentle hand on the shoulder, steering them back to the seat, actually may be really appropriate. And that's not something I would recommend for all children, but for many children, that can be very appropriate, because and you will see that's how their parents steer them through the world too. That's okay. It's hard to judge, it's hard to know.
Yeah, kind of decide case by case basis,
Yeah.
but it's more general recommendation. I think that's pretty much, but with communication, like as we said, like these are kind of things that you need to be mindful of. Speak slowly and clearly, allow time for the child to process information. Do not use like metaphors, because they might not really have equal understanding. የምሳሌው አነጋገር አይ ቲንክ ለእኛም የሚከብድ ይመስለኛል። ምሳሌው አነጋገሮች ምን እናገራቸዋለሁ አይደል በኮሚኒቲያችን እነዛ it's really hard to understand for them. Keep instruction very short and very precise and clear. Use basic language in delivering session. Avoid relying on gesture, facial expression, or tone of voice. Those are, critical kind of communication skills that you can take into account.
Thank you.
So that's pretty much very basic, but I hope it really kind of gives some kind of insightful conversation.
I have just a question for you all. When you teach your lessons, you teach in English or Amharic?
English.
Well, on Saturday class they're learning Amharic, and Sundays is English private class.
In my office, I really try to emphasize, to a family, speak only Amharic at home. I really want you to teach your children the language, right? It's a gift. And of course, the English they will learn, right? You can't stop that. And then when it comes to so many of the services for children with autism or just sort of other kinds of speech delays, all the treatments are in English, right? It's very hard to get it in your language, and that's something I really feel bad about, right? Because I really want to emphasize the family's language, and then if they have to go to some therapist comes to the home and speaks English, I feel like we're really disrupting that, and so that's something I'm often torn about in the office.
Thanks for mentioning that. That is a reality.
And it's hard, and then families think, oh, I have to stop speaking Amharic because the therapist only speaks English. I'd like to say no, but realistically, sometimes that is the best thing, even though it's not really what I want. I think that's a challenge too.
Yeah, simultaneously I would like to as well emphasize the different perspective, like knowing the mother tongue language is really essential, especially in this line of work, and as well for the kids, because we're talking about like different emotions, feeling, which is really hard to explain it, like especially a parent who's just speaking Amharic. It's really hard to like giving that terminology or giving that the full picture in terms of expressing their feelings and emotion. So for the kids, like really knowing their mother tongue is really helpful, because they can really make it easier for the parent to understand. Because that I see as well kind of a gap. The kids might feel different way and the parent is not understanding. That really helps as well in the helping the relationship between the parent and the kid. It really creates a bigger gap, because the parent might not really understand in a way the kid is explaining their emotions and feelings, because it needs that level of language understanding, because terminologies are very complex. So knowing the mother tongue in these dynamics are also
but I think as you all know, that's true for children without autism, right?
Yes,
all of your children probably, right? Who prefer to speak English, right? Once they've gone to first grade, right? They don't, so that's tough. I agree, that's a gap. I see that in families from every country, right? Where they start to develop that language barrier between parent and child.
I remember a parent who's coming, like she has cancer, and the kid she doesn't really understand her in general, like her feelings, emotion, the struggle that she's going through. She's not understanding her in general because the mom is speaking only in Arabic and the kid is only speaking English. There's already like a gap in communication. There is no like helping the relationship between the kid and the mom. Simultaneously with the parent and the kid. It's more or less the same. So knowing the language and especially creating that language competency between like parents and caregiver and as well the kid is essential, especially in this line of work. So talking about emotions, feeling is very difficult. We don't even have a terminology in our language. So knowing that, like especially for a kid who is really speaking only English, for mom, how can she be able to understand and be helpful? So I think you're really doing an amazing job. I would like to emphasize that, giving them that language competency because it definitely fills that gap. Yeah.
I wanted to ask, oh sorry. Are there like known defense mechanisms on their end that they might have just based on if they're like perceived as being different? You know what I mean? Like, do they kind of try to beat us to the punch by doing something because they think that we're going to treat them differently, or maybe they do notice that they're being treated differently?
That's a great question. I would say of course there's a range for all these things. Younger kids have much less of that awareness of being different, but it's something that you start to see more and more with teenagers. And one of the ways they do it is just by sort of regressing or keeping away or withdrawing, right? Because if I don't speak up, nobody can hear that I speak funny, or if I don't go, try to make a friend, nobody can know that I don't make friends well. So I think that's the most common would be withdrawal. And things that try not to draw attention to themselves, right?
Yeah, technically, those are the things that we make as well, getting additional professional support, like ABA therapists. What they do is like improving their skill, like coping skill. These are like a coping skill that they could learn through time. So for early childhood, like it's really hard for them to develop like a certain and such coping skill, but it's something that they can learn. Sometimes they learn it through struggle and problems and challenges, but with earlier intervention, they can get like proper support in terms of developing that coping skill. They're like, for instance, as Dr. Singer has mentioned, like withdrawal. It's really a coping skill, one of a coping skill. But where do they learn? It shouldn't be from a challenge or a problem. They can definitely get that intervention earlier on. There is a professional support that exists. So that's the reason that you need to be early detected or diagnosed early so that they can get those proper support.
I just want to add something then I will be quiet. One of you, out of this many people, mentioned the last time one of the kids who have diagnosed and his autism, he have a hard time sitting in one place. His attention span is maybe 10 minutes, 15 minutes. After that, he gets emotional. He cannot sit. So one of the techniques they used was to let him, go out, walk around and come back when he sits down. So that kind of things might help you in the classroom too. I don't know if you can add some, other options as a solution for these kids, how to handle them. And the second thing I want to add is, from the family's perspective, this is a safe place for the families. They bring their kids, and this might be the only time they get peace of mind.
Yeah.
Because look at it, they are running around, what she said, what kind of, activities will happen, she's, keeping in her mind, and she's worried every minute. So the only place that they think is safe becomes unsafe because of the way we treat the kids, then the family will withdraw. And we might, instead of being the help hand, we become the problem as well. So when we deal the kids, please be aware of this. You remember you were here last time. There was a conversation about autism. One of the family member was mentioning opening up, and she was even speaking about her kids. I don't want to use this word, but unfortunately I have to. When they go to the bathroom, they play with their, and she has to protect that from the kids. So that kind of behavior will be exhibited in their house or outside, and they are dealing with this emotion. And when they come here, that's when they try to have, a little bit of peace. So be aware of those kids. That's basically what I wanted to say. And let's try to be a helping hand.
Yeah. Just to say two things in terms of like the different methods and techniques, it's definitely based on like case by case. Like for someone that we taught is like a coping skill might not be applicable for the other one. So that will be decided mainly like with whenever you have like ABA therapists, they will really like learn the experience and behaviors and so on and give you those kind of recommendations in terms of coping skill. For some it's maybe withdrawal, or for some like it really depends on a case by case basis. And I can't say like homogeneously like treat like or like children with autism is a certain way, because it's really different from children to children. But for parents and caregivers who are coming here, definitely this space is very welcoming space, creating safe and calm environment for the kids. But at the same time, like it requires from us as well creating enabling environment. This is really an external environment, so enabling environment, which means all community be responsive, understanding, and being compassionate in supporting this family member. Because as much as we do like a lot of understandings, creating an awareness, people in the environment would have an understanding. So not only like we expect from the parent to act upon, any individual within this setting would be very helpful and responsive to that kid. So we need to do a lot of awareness creation, sensitizing the community so that we can be, all of us can be responsive to such act, not only expecting from a such parent. So yeah, I think it comes with sensitization and understanding on this matter. Anything that you could add?
No, I mean, I think in terms of the attitude change and the welcoming, I couldn't say it better than you, but I agree, like having a solution where the child gets up and walks around and comes back to the classroom, that's a great non-disruptive way to do it. Or maybe a child who needs some kind of sort of like a toy to have in his hands to be, playing with and fidgeting with, right? Like something that doesn't make a lot of noise, but that, that they could keep his hands busy or something like that. That's easy, right? It's maybe not the behavior we love all the time, but if it's not so disruptive, that's the kind of thing that, probably really helps the kid, and it's not so hard for us to put up. Little examples like that. And I think there's, for many kids that works, and I think it's also a nice way. It teaches the other kids a nice lesson, like, oh, your classmate needs something a little bit different, and like this is his way, like I said, this is his way of coping. Or my son, in elementary school, had a classmate with autism who got to go out of the classroom a lot. My son's favorite thing was going out and playing soccer at recess, right? And he started to get a little jealous, like, why does he always get to go out? I'm still in the classroom. But actually, after a little bit of time, he just realized, oh, like he has different needs. And actually, that was a really important lesson for my son, right? Like, so I feel like he really benefited from seeing the way this other child was taken care of.
Thank you so much for
Thank
this.
you,
This
yeah.
is really helpful.
Thank you for taking time.
Thank you all for what you all are doing.
And your daughter too, thank you too.
We've asked a lot of her today.
And I really would like to extend like an appreciation to Dr. Singer. He's really like very committed and dedicated in supporting the Habesha community in general in his line of work. And on top of that, he's really dedicated as well for this specific like line of work, especially autism. And whenever we ask him for this kind of workshops, he's like without any hesitation, without any putting any challenge, you're like, yes, I can come. So I always appreciate his commitment and dedication. And